United States of America is the only industrialized country in the world without a single-payer universal health care system. We've tried 7 times. 100 years ago, President Theodore Roosevelt tried. President Franklin Roosevelt tried during the Great Depression. Harry Truman tried right after World War II. President Johnson, though he passed Medicare and Medicaid, tried. President Nixon tried in '74. Senator Ted Kennedy tried. President Bill Clinton and Hillary tried. President Obama passed the Affordable Care Act that covered 14 million new people who were uninsured but left 30 million Americans uninsured. Why is the United States the only developed country in the world without universal health care? We know why. The usual suspects: the American Medical Association, the drug companies, Big Pharma. They pour millions of dollars into their smear and fear campaigns, and they demonize universal coverage. We've heard it all before, time and time again. They call it socialized medicine. They call it a government takeover of health care. They say that government bureaucrats will stand between you and your doctor. They say that death panels will be created. But we know the real reason why they oppose universal health care is to protect their obscene profits. Last year, private insurance companies made over $9 billion in profits. Over the last 10 years, the 11 largest pharmaceutical companies made over $700 billion. The CEOs of those 11 big pharma companies made $1.6 billion. A single-payer system would take the profit motive out of health care. It would lower direct costs. It would eliminate all the excessive administrative costs to go with the hundreds of forms that now have to be filled out. So what has this profit motive, profit-driven, private health care system bought us? We Americans spend 2.5 times more on health care than other industrialized nations. We have fewer doctors per capita. We make fewer visits to doctors and hospitals. Our life expectancy is lower. Our childhood immunization rates are lower. Our infant mortality is higher. Even with Obamacare, 30 million Americans do not have insurance. While our neighbors to the north in Canada, every man, woman, and child is covered. 1 million Americans a year go into bankruptcy because of medical expenses. In Canada, that number is 0. 115 million Americans go without medical care because of high medical costs. In Canada, that number is 0. 45,000 Americans die each year because they do not have insurance. In Canada, that number is 0. Now, why is the minister talking about health care? It's because in addition to being a medical and economic issue, health care is a moral issue. It's a matter of right and wrong. It's a matter of life and death. Just a few years ago, I performed the funeral for a young man named Eddie Lee. He had a simple infection, but he did not see a doctor because he didn't have insurance. He would be here today if he lived in Canada or Great Britain or France or Germany. As a minister, I spend a lot of time with sick and dying people. And what I observe over and over again is that in addition to their worry about their health and about the possibility of dying, they also have to worry about their financial well-being. There is a layer of anxiety on top of anxiety. Health care is a moral issue because human values should trump market values. People are more important than profits, and health care should be a right for all, not a luxury for a few. In civilized society, people do not live by the law of the jungle. in which is every man for himself and a dog-eat-dog world. In civilized societies, we have a social contract in which we are bound to each other with mutual responsibilities. We pay our taxes to ensure that every human being has the essentials of life: clean air and water, fire and police protection, streets and highways, an education, a retirement pension, and it should be health care as well. In civilized society, we share the risk of life because your house could burn down, your car could be broken into, you could have a stroke, you could be born with genes that predispose you to have breast cancer. We share those risks in civilized societies. In a civilized society, you don't go in alone. In a civilized society, we look after each other because we're all in this boat together, because all of us as human beings are vulnerable to the vicissitudes of life. It's time that the United States of America join the rest of the civilized world and provide single-payer, universal health care.